It's a problem. It's what you're doing all the time, like every day. So in the office, what was another question? Oh, okay. This is opposite what the medical field told us to say. They told us to think. Did you guys hear it or not? Who funds the medical school? Thanks, Ella. See ya. See, Ella's going to come in and she's inviting her family member. So who funds the medical school?
The government.
The American Medical Association funds them. Who funds them? Okay, the drug companies fund the medical schools. All those medical schools are run by drug pharmaceutical companies. The pharmaceutical companies is what allows the medical schools to exist to begin with.
Good for you.
What happens to the American Medical Association if everybody in America gets healthy all of a sudden? You only have emergency problems. You just chop off something every now and then, you need a surgery. You know, every now and then you have a little tumor, a heart attack, you need to go to the hospital. But it happens, it reduces by 75 or 80%. What happens to them? They're powerless. Those guys, man, have you seen their cars? I mean, I have a nice car, but, you know, like I'm here now, I work pretty hard, you know what I mean? Somebody has to be kind of crazy to do what I do. We just have 5 minutes, we'll go over a few things, and then when we're done, you can get with Ismail or Lisa, who are walking around here somewhere. You can hand them the form and let them know if you're interested in learning more. You're welcome to come to the office. You can schedule a time. Ismail's back. Is Lisa back there? Or?
I don't know.
Oh, she's back there? Okay. And then we can go over this more with you. Somebody has to be pretty crazy to do the kind of stuff that we do. I mean, seriously. Like, I'm not saying I do this every month, every month of the year, but a lot of the time I'll see patients, you know, most days of the week, like maybe Monday, Wednesday, Thursday, and a Friday. And then I'm at the office a lot, and then I'll study this kind of stuff on weekends, and then I go to continuing education seminars. I'm like having people call me in the morning, having people call me at the night with questions, having people call me on the weekends, or doing all these different things. And we're treating the underlying causes of people's health concerns, and nobody believes it's true. And Americans are taught to do X, Y, and Z thing for their health concern. When you go to, you know, the farmer's market, or if you go to Safeway, or if you go to Whole Foods, and you want to get some asparagus and avocados and some steak and stuff like that, you don't give them insurance. You really need that. You need to eat food to stay alive, right? So when it comes to your health, if you're having trouble walking, or you have a pain that's been there for 8 or 10 years in your low back, or your hip, or your knee, or whatever, or you're taking a medication, which about 55% of us now are on one or more medications. And if we're at 65 years or older, we're taking 2 or more medications. So if that's what's going on, there's a little confusion about what health is and what health isn't. And how did things get the way they are now in this country? We're number 64 in the world when it comes to healthcare. That means there's 63 other